Cincinnati Children's has dedicated resources to help families have a better outcome. They use evidence to guide practice, and therefore they've recognized that families' access to resources such as child life and integrative care actually create and promote a more positive overall healthcare experience.
Child Life, specifically here at College Hill, we work with a lot of patients with psychiatric and mental health needs. We do a lot of procedural support and help with that, as well as developmentally and therapeutic appropriate play, a lot of grief and loss support, and just normalizing the hospital so it's a safe and comfortable spot for the patients to be.
Our focus really is on the whole child. So that means mind, body, and soul. Our team is really dedicated to giving the children experiences that will help them manage expectations once they leave here.
When we come in and provide developmentally appropriate play and leisure, it's truly things that the patients are just interested in, but we're not having them talk about their thoughts and feelings. We're just letting them have very unstructured time that they can be kids and teenagers. Sometimes these kids don't know how to play fair with other kids. They don't know how to cope with they lost in something or cope with another peer taking their turn away from them. So having play allows for a structured time to learn problem-solving skills, coping skills, even like emotional regulation skills.
There is one area that both Child Life and Integrative Care staff members really facilitate for a child and family, and that's grief and loss. Those are opportunities that we can provide for them to really explore in a really safe and healthy way of how to cope with loss. It's not something that we shy away from, it's something that we help them understand and appreciate.
Do you have any ideas about what you're gonna do here?
The art therapist, it's about their relationship, and the art is the media that you use to communicate.
Giving them opportunities to express themselves when there are no words to really define how they're feeling.
What is going on inside of me? I don't even know, but I can show you the color that it is. I can put a shape to that. I can get a feeling out with what I'm creating.
The kids that I see benefiting the most from music therapy are the kids that really struggle with a lot of the other areas of treatment, especially verbal areas. It's kids where words don't come naturally for them. It can be singing, it can be rapping, it can be creating their own songs, playing instruments, moving to music, just whatever helps them with whatever they want to make better in their lives.
Any of the emotions that we feel, it's so easy to get carried away with that. And so the massage, the mindfulness, the yoga, it's almost like all of those things allow us to like push the pause button. So it allows us to kind of take a step back and look at the whole picture with a clearer mind so that then we're hopefully making wiser decisions and choices.
We also do other things like traditional play in the gym with the latency age kids, cooperative games. But we also do our low ropes course and our high ropes course. We have experiential therapy that we do, which focuses on teamwork, assertiveness training, advocacy for self, relationships, and being able to be in a group even if you don't like that person. It's a skill that most kids don't have, especially being in the hospital.
Let's check it out. Let's see if we need any more dirt.
Horticulture is great for a variety of reasons. One being it's an alternative therapy to traditional sit-down, do a worksheet, kind of things the kids are able to use their hands, they're able to see the therapy concepts in action, and they can see it practically how their behavior affects a living being.
Our job is really to cater our intervention, bring our resources in, really ultimately based on what they need.
A lot of these kids have either never been in a hospital or have never been in a psychiatric facility. We help celebrate holidays, we help celebrate birthdays, we even help celebrate when a child has a really awesome day and they just learn some new coping skills, and we're there to praise them and say like, hey, like this might be an unfortunate situation to be in, but here you are and you're getting through it.
There you go, better.
I've always loved kids. I love their energy, I love their spirit, I love their creativity, I love their resilience, I love their hope.
The growth that you can see in them in a short amount of time is just amazing. It's astonishing. And to be a part of that is a huge blessing.
The people here are definitely a reason why I keep coming back day after day, even after those really tough days.
This particular job in mental health is one of the most rewarding careers out there.
We have invested time and talent into serving this population in a way that no other organization does.